Cyber Week NCLEX review. Now, this NCLEX review, remember guys, this NCLEX review is Hot Topic Thursday. Hot Topic Thursday. I had got on yesterday and I had told everybody that I was coming back today and tomorrow. Okay, so today and tomorrow at 2 p.m. Eastern time, you will spend some studying time with me. Okay, all right, so listen, you guys, if you have purchased any REMAR review product in the last 2 weeks, please join my boot camp. All right, join it, and it's super easy to join. All you have to do for the boot camp is to click the link that's on this video, and you will get weekly emails from me, okay? And in these emails, I'm going to be showing you how to use the product every week. Hey, how you guys doing? Hi, Rosalind. Hi. Hi, you guys. Okay, so you will get my boot camp. I'm talking about the boot camp. You'll get weekly emails from me. You will be getting more topics to study, okay? Making sure you don't forget these topics. You'll be getting milestone reminders. And the reason why I'm doing this, hi, Abby. The reason why I'm doing this is because, you know, I want to make REMAR review different from other NCLEX reviews. And I think the best way to do that is to provide aftercare, all right? We were one of the first ones to say, hey, if you went to the live class, you would get 30 days in the online program for aftercare. Now what we're doing is that we're going to take it even a step further, okay? You will become part of our community where I will make it my job to follow up with you guys, all right? So the boot camp is what I'm talking about, because you guys know that you can join me here and you can listen to what I'm saying, and you know, it can sound good and you can think like, okay, yes, she's saying this, it sounds good. But if you are not executing on the things that I'm telling you to do, if you're not being consistent with the information, then it will not lead to successful results, okay? So when people tell me, yeah, you know, I listened to the DVDs, I did the self-study program, but I didn't pass NCLEX, one of my first questions is, did you finish the program? Did you finish the program? And some people will say, yeah, I finished the program, but, you know, I didn't really give it 100%, or, you know, I really didn't study like I should have. Just talk to somebody today like that, all right? So let's do it together, okay? Let me take it another step further and make sure that everybody who made an investment in themselves this week, all right, for Cyber Week, this online academy, discounted, all right, the DVD packages have been discounted. Everybody who has made an investment in themselves, let's make sure that you guys follow through with that investment, okay? All right, so again, Hot Topic Thursday, all right? And these are the topics. How many topics do I have here? I don't know. I have a lot of topics, but these are the topics that you guys need to know before you take NCLEX. And I'm serious. I'm not just saying this just to be saying it. I don't get on here to waste my time. I get on here to help you pass NCLEX. So get out a piece of paper and get out a pen so you can take notes and you can help me to get through this information. Now, everybody in the boot camp, I'm going to send you a transcript of the topics that I'm talking about today. So if you're in the boot camp, you will get these hot topics, and I may even add some more topics to this list. But anyways, okay, are you guys ready? Let us begin. Are you ready? I can't see. Are you ready? Tell me if you're ready or not. Does everybody have their package? Yes, the self-study is still available. The self-study package is still available, and it is in stock. There was some confusion about whether we had ran out of the self-study program. We have not ran out of the self-study program. We have it in stock. So, okay, are we guys ready? Are you ready? If you're ready, put hearts on the screen. Let me see some hearts for our hot topics. I'm ready. Janine's ready. Where's the link for the boot camp? It should be in this. It should be in this video link. Okay, so if you refresh your page. All right. I see the hearts. I see the hearts. All right, let's go. All right, our first hot topic that you have to study for NCLEX. Okay, because when you sit down and take the test, they will ask you about this. The first hot topic is actually rape, okay? What are your nursing responsibilities when a woman has been raped, okay? You'll get a scenario that a woman, she may come into the emergency room and she has been raped. What are your nursing priorities? All right. Let me say something to you. There are some instances where nurses always have to report to the authorities, especially if you're working in the emergency room. If you're working in the emergency room and a woman comes in and says she has been raped, you have to report that to the authorities. You have to report that. Can you guys think of anything else? What else? What other instances do nurses always have to report to the authorities? Yes, they just say it. Don't be afraid. It's okay. But what? Just say it. Does anybody have anything? Oh, am I thinking? What about? What about child abuse? We always have to report suspected child abuse. Also, elder abuse. We always have to report suspected elder abuse. There's something else that I'm thinking of, and I don't know if anybody has it. Nobody has put it. It's interesting. Also, dog bites. All right. If someone has come in and they've been bitten by a dog, we have to report that. Did you guys know that? All right. So anyways, report rapes, report child abuse, elder abuse, and dog bites. If you know of anything else that nurses always have to report, put it on the screen and help out everybody that's studying with you, because we are a community here. We're learning. There are about 200 people studying with us right now. All right. So I'm talking about rape. Our first hot topic is rape. So we know we have to report rape. We always have to report it. Okay. Also, do we make the person feel ashamed that has been raped? Do we make the person feel ashamed? No. Well, we never make the woman feel ashamed. And one more thing. Should that patient take a shower? I know this is so simple. No, there's no packet for the hot topic. We're just taking notes, okay? We're taking notes on rape. Should that person take a shower? If a woman comes in and she says she's been raped, should she take a shower? What do you guys think? Abuse, privacy. No, she should not take a shower, because what is that going to do? That is going to wash away maybe physical evidence. That may wash away any places where bleeding could be coming from, and we no longer see those things, okay? So you guys are following. You guys are right with me, okay? Child abuse, yes. So now I'm getting the comments that are coming in. All right. So yes, okay? So when a woman has been raped, no shower for that woman. No shower for that woman. And I have seen NCLEX questions where they discuss rape, and taking a shower is always an option. Taking the shower is like always an option when I'm doing practice questions. And it sounds really good, because it'll be like, yes, advise the woman to take a shower because she feels dirty. All right. And that is never going to be the right answer. All right. So we're clear on rape. We know what to think about when we get that question. All right. The next hot topic, we're on hot topic number 2. You guys ready? Hot topic number 2 is baby abduction. Baby abduction. What to do if you're in a scenario when a baby has been abducted from the hospital, from the newborn nursery. All right. So, first of all, we as nurses, all right, and this goes back to being therapeutic. This goes back to therapeutic communication. First of all, we never ask the mother why, okay? We never ask the mother anything in regards to why you left the baby alone or why you didn't have the baby in your room at this time. You never blame the mother, okay, whenever a baby has been abducted. All right. The second thing is you guys have to remember that when a baby is abducted from the hospital security, how do I say this? Hospital security are basically, I don't want to say it the right way. Okay. Hospital security are basically powerless in a sense that they cannot just they can't just search people, okay? So if somebody has a big bag, like if somebody has a suitcase, is the hospital security allowed to go into that suitcase and look for the baby? Nope. can't do it. Is the hospital security allowed to detain suspicious looking people? Nope, can't do it. They cannot violate people's constitutional rights. Okay, so you listen, you cannot search anybody's property unless you have a search warrant. All right, so that would be an option for NCLEX. If a baby's abducted, can the hospital security search bags? No, they cannot. All right, all right. But what we can do is we can call a code Adam. All right, we call a code Adam, and you can lock the nursery area, which is normally done already. Okay, but I don't want you to get tripped up on that searching of bags. All right, because that's something that I see frequently as well. Okay, all right, we ready for the third hot topic? These topics are hot. Okay, when I mean hot, they're hot. All right, so the third hot topic is sexual reassignment surgery. All right, so what I'm talking about, are you guys studying this stuff? I don't know if you're studying this stuff. Sexual reassignment surgery, when a man has had the surgery to have girl parts. All right, so I was reading on this last night, and because this is something that is accepted in culture, and because it's something that is being done very frequently, we as nurses have to know how to care for these patients, okay? And a lot of NCLEX, as you guys know, is a lot of patient education. And when it comes to men who used to be women, men who used to be men who are now women, they have to learn about female health education. They have to know the timing for screenings and such and such. So, all right, so men who are now women, the first question I have, and I want you guys to answer, do they need to have pap smears? Because this is something that you as a nurse need to know. If I used to be a man, but now I'm a woman, do I need to have a pap smear? Do I need to have a cervical pap smear? What say you guys? What say a few? Let me know. Do we advise them? Let me see if I can. This Facebook. What do you guys think? Yes, no, I don't know. Some people are like, I don't know. That's why I'm here. I'm here for hot topics. I'm here to learn. Okay, so listen. If you used to be a man and you now have girl parts, okay, one girl part that you won't have is the cervix, okay? Because remember, pap smears are testing what has gone into the cervix, right? So if you don't have a cervix, then you don't need a cervical pap smear, all right? So that will get you, okay? Because if a transgender female comes in and says, when do I get my first pap smear? You got to know. You got to let them know. Sweetie, you won't be getting a pap smear here, all right? But you can get a mammogram, all right? You can get a mammogram because anybody, and I just read this last night, okay, you guys, let me tell you something. There are some subjects that I'm not ashamed to say I don't know anything about, and this was one of them. So I had to do my due diligence. So if you are a man and you have been taking female hormones for 5 years or more, you have to get a mammogram. You can get a mammogram, okay? Because the hormones will make you develop breasts. So transgender females have no need for cervical pap smears, but they do have a need for mammograms. Okay? Now, let me say this to you guys about that. All right. So if you are a man and you are a homosexual male, and listen, this goes back to nursing education, okay? This goes back to nursing education. So if you, if you are a man and you are a homosexual male, you may need to get a pap smear, okay? And because there's two types of pap smears. There's a cervical pap smear, and then there's a rectal pap smear. Okay, so homosexual males get rectal pap smears. All right, and they are supposed to get them once a year. All right, fine. That's all I have to say about that. Oh, okay. No, that's not all I have to say about that. One more thing about transgenders, okay? If you are a woman and you are living your life as a man, but you have not had the surgery, okay? So you have all your girl parts. Do you guys think that a woman living her life as a man still needs to get a cervical pap smear? What do you guys think about that? Because this is like the critical thinking. What do you think? Transgender women who have not had the surgery, do they still need to get pap smears? Everybody's saying yes, absolutely, because you still, good job. Yes, Faith, because you still have your girl parts. So you would get the cervical pap smear and the mammogram. Perfect. All right. And remember, and I just read this, that we used to encourage women to do self-breast exams, but the National Cancer Society says that those are not the best way to screen for breast cancer. So they don't recommend women doing it anymore. Did you guys know that? I don't know. Tell me if you knew that, because I didn't. I just was like, okay. I read it and I was like, cool. All right. So we are moving on to another hot topic. We are moving on. Are you taking your notes? All right. Have you joined the boot camp? Because I'm sending these hot topics in the boot camp. Another hot topic is that I want you guys to know about infants. I talked about baby abduction, but I want you guys to know the basics of infants, okay? So I'm talking about, and I go over this if you have the lectures, I'm talking about the normal infant vital signs. You need to know the normal heart rate, the normal blood pressure, the normal respirations of newborns, okay? NCLEX can be sticklers about that topic. Also, how many, does anybody know? Can anybody put up on the screen? How many wet diapers should an infant have a day? How many wet diapers should a normal infant have a day? What do you guys think? Okay. Hotness. This is hotness. I know it seems common, but it's not. All right. How do you join the boot camp? There's a list. Oh, I love it. Yes. Elise, Kara. All right. Azia, 10 plus. Okay. All right, let me give you the normal. You guys are throwing out some numbers. The normal that I have is about 5 to 8. Okay, 5 to 8 wet diapers. All right. How many bowel movements? How many bowel movements for a breastfed baby? What's the difference between breastfed and bottle babies? Are there going to be different breastfed and bottle babies? Absolutely, absolutely. Breastfed babies. Did you guys know that breast milk has a natural laxative in it? Okay, so breast milk, and there's something, you know what? There's not many things that I like to get on my hobby horse about, but breastfeeding is one of them, because breast milk is just so it's so amazing how it is specifically made for babies. All right, so breastfed babies can have 2 to 3 bowel movements a day, because literally every time they eat, the breast milk makes them, go to the bathroom. All right. Whereas formula fed babies, they may experience constipation. All right. So they may have a bowel movement once a day. And it may be common for them to go 2 and 3 days without a bowel movement, because what does formula have in it that is very constipating for infants? They might know. Put it on the screen. Put it on the screen. Share your information. Share your knowledge. What does formula? What does Similac and I don't know what other kind of formula is there out there? Gerber. What does that have in it that makes newborns very constipated? Anybody know? Fiber. Iron will constipate you guys, and you know that whenever we cow's milk iron. whenever we give even our adult patients iron supplements, we tell them that it can cause constipation. All right. Okay, I'm moving on. So that was hot topic number 4. Hot topic number 5, caffeine. Caffeine. And I know it sounds simple, all right, but let me tell you something about caffeine. You can find caffeine. Let me tell you the places you can find caffeine, and this is not the stuff that you don't know. You guys know we can find caffeine in pop. We say pop where I'm from. I know some people say soda. I say pop. I know some people say cola for everything. Even if it's not cola, if it's a soda, they'll call it cola. But anyways, you can find caffeine in any kind of soda. You can find caffeine in tea. You can also find it in coffee, right? And also there's caffeine in chocolate. So if you eat a lot of chocolate, it has caffeine in it too sometimes. So anyhow, NCLEX will ask you, does caffeine cause constipation, or does caffeine cause diarrhea? Isn't that interesting? Do you guys think caffeine causes constipation or diarrhea? This is critical thinking. No, yes, diarrhea, constipation. So mixed, right? So mixed. All right, so caffeine, hey, can I get a charger? Sorry, you guys. I'm on my laptop. I don't want my laptop to die while I'm doing this. Okay, caffeine. Yes, some people who Google it. Yes, Google it. All right, some people have taken NCLEX already, and they're like, this girl is preaching today. All right, so anyways, caffeine can cause constipation because caffeine is what? It dehydrates you. Caffeine, when you drink a lot of soda, when you drink a lot of coffee, it actually is a dehydrant. So it will cause you to be constipated. So if a person drinks, if a person drinks 8 cups of coffee a day, that's a lot of coffee. But if a person drinks 8 cups of coffee a day, they can experience constipation because it'll dry your body out. All right. I'm moving on. You guys are right with me today. Thank you so much for following with me. Yes, exactly. Somebody said because it constricts. Avani, good job. Yes, I like that. All right, thank you guys. You guys are helping me teach this. I love this. This is what this is about. This is what this is. I hear you, Christina. This is what this is about. These study sessions, they're not just for me to get up here and just blah, 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 blah. I want it to be like a community where we study together. Because if y'all just want to hear me talk, I do that on YouTube. All right. So here we go. DNR request. What does DNR stand for? DNR stands for do not resuscitate. Now, for NCLEX, the Patient Self-Determination Act is big, okay? It's called Patient. Can I type that on here? I can type. Oh, I need somebody else. You got it. Patient Self-Determination Act. Okay. Study that. So just study that, what it is, because that is where all of our advanced directives come from, okay? Advanced directives, I talk about that. Your living will, your durable power of attorney, those things come from that patient self-determination, okay? So patients make decisions. So when we talk about a do not resuscitate order, we need to know the things that can be discussed in a do not resuscitate order. So for example, you guys, listen to me. If a patient is a DNR, can we still give them pain medication? Critical thinking, okay? If a patient is a DNR, would you give them pain medication? Would you give them morphine for pain if they were a DNR? What do you guys think? Okay. And this is why I say that, this information is really just book knowledge. It's it's nothing that you guys cannot master. It's nothing that you guys cannot demonstrate competency in, but it takes you by surprise sometimes because you haven't never been in the situation before. So this is where the critical thinking comes in. So yes, you guys are saying that's so correct. Yes, they can be free from pain. All right. So yes, this is pain medication, oxygen. That's all part of comfort care. So you can give them pain medication. All right. But I had a student ask me that, and she picked on her exam that you could not because of the DNR. Okay. So we just want to clarify that. All right. All right. Okay. Moving on. Okay. Because we're going to study patient self-determination. We're going to know about our DNRs and that we can still make them comfortable. Yes, and of course, I'm going to say this, but I'm not going to say this. I'm not going to tell you guys that if a patient is DNR, you do not do CPR on them, all right, because you already know that. So I'm not going to say that. All right. Okay. Next topic, okay? And I got to go, okay? All right. Next topic is MAOIs. What is a MAOI? Oh, you got to know this. You got to know this, especially if you're taking, listen, okay? You only have to know MAOIs if you're taking NCLEX RN, okay? And you only have to know MAOIs if you're taking NCLEX PN, all right? And other than that, you don't got to know them. So let me just tell you this, all right? MAOIs, yes, stay away from tyramines, Charlie, good job, all right? So MAOIs are a classification of psych medication. So I am talking about pharmacology here, okay? So this is a psych medication. What kind of psych medication is MAOIs? Hot topic. What kind of psych medication is MAOIs? All right. You guys, you know what? You do really need to share this. If you have nursing, listen, you need to be sharing this information because I'm setting some people free today. MAOIs, what kind of medication is it? Antidepressant, yes. Okay, yes, Shirley, it's an antidepressant, all right? Okay, so it is an antidepressant. You need to know about MAOIs. How long does it take before this psych medication starts to work? How long? Is this a medication that's going to work right away? All right, or is this medication going to, I don't know. Is it going to take weeks and weeks, or is it going to work right away? What is the teaching for this antidepressant? What saith you guys? And anybody who has my review, you know you need to get all these answers right, okay? 14 days, 2 weeks? No. A little bit more, 2 weeks, a little bit longer than that. Yeah, Farah. Yes, Marcella, it takes time, okay? Longer than 2 weeks, though. You don't know. It's okay. This medication, MAOI, usually takes like 4 to 6 weeks to work, okay? So NCLEX will say, they'll put you in a scenario. They'll say the patient comes in, they've been taking MAOI for 2 weeks, and they are not improving. They don't feel happy. What is the best response by the nurse, okay? And the best response by the nurse is what? That this medication takes time. So because this medication takes time to work, what other medication can be prescribed while the patient is taking an MAOI? There's another psych medication that helps you feel happier faster that you can take until your MAOI starts to work. Does anybody know what that is? Anybody? Okay. You can give a short acting. Let me see, does anybody know? Months, takes a little while. No, SSRIs, no, you guys know better than that, okay? You can never take a MAOI with a SSRI. Never do you take those two together, okay? So study SSRIs and study MAOIs. Yes, Carrie, you got it. Benzodiazepines. So like Ativan, Valium, Xanax. Those medications are short acting. Any lorazepam, diazepam, those are the names you need to know. Lorazepam, diazepam, those are the ones that you can take with the MAOI because the benzodiazepines will start working fast and the MAOIs will take weeks and weeks to work, okay? So you guys need to know that. Also, you guys need to know which foods you cannot have when you are taking an MAOI, because you do have to stay away from tyramine, all right? And because if your patient gets a food in it that has tyramine and they have a MAOI on board in their system, they can have a hypertensive crisis, okay? So tyramine is in a lot of foods, okay? Tyramine is in everything. It's in chocolate, it's in beer, it is in anything with yeast in it, any kind of bread, pancakes, birthday cakes. So study that, okay? Make sure you guys know that. All right. That was my next hot topic. Share these hot topics, all right? I'm almost, okay, I just got 2 more. Organ meats, yes. Anything that is preserved, I like that. All right. Organ meat, pork, it would be in like, what do people eat? Pork? It would be like if you eat chitlins, it would be in the intestines of the pork. If you want to eat those, you cannot eat those if you're on an MAOI, all right? All right, here we go. The last, okay, so 2 more. Okay, pain medication. All right, all I have to say about pain medication, if you see that on NCLEX, you know when you give somebody a narcotic to monitor their what? What decreases when a person has pain medication like morphine, hydromorphone? What do we have to watch for? All right, it's usually the #1 priority. And you guys just go ahead and put it down. Yep, Shirley. Respirations, okay? Respirations. So that's what I want to say about that. The oxygenation status will go down, all right? I'm doing hot topics. My last hot topic I got from Sophia just like 2 minutes before I jumped on, so I wrote it down. Cushing's syndrome. She was doing the package. She has a DVD package. She asked me about Cushing's syndrome. And you guys know Cushing's syndrome patients, we know it is, we know they have increased steroids in their body, increased cortisol, all right? And that gives them the shape of their body changing. So they have the moon face, the buffalo hump, all right? All those things. But specifically for NCLEX, you want to know that Cushing's syndrome patients are immunocompromised. They have a very suppressed immune system. So they get sick very easily, all right? They get infections very easily. So sometimes Cushing's patients need to be placed in private rooms. Okay, so this is a hot topic for NCLEX, you guys. If you have a patient with Cushing's syndrome, sometimes you need to put them in their own room so they don't get infections from other people, all right? So the white blood cell count of Cushing's patients are typically elevated because they are battling some sort of infection, all right? Another thing that will be elevated in Cushing's patients is their, low immunity risk for infection. Another thing that will be elevated is their blood sugar, okay? And we talked about this on the last NCLEX review on Friday, how steroids increase the blood sugar. So if you have a condition where the body is giving you too much cortisol, too much steroids, then you'll have a problem with your blood sugar being too high. So in Cushing's syndrome, you see an increase in blood glucose levels, you see an increase in the white blood cell count, but you will see actually a decrease in their potassium level. So the potassium level goes down in Cushing's syndrome. It's very interesting. They leak potassium, okay? All right. So you guys, did you enjoy hot topics? Because that's it. Those are my hot topics that I have for you guys today. And they were hot, okay? So add these to your studying notes. Thank you guys for teaching it for me. You guys did most of the work, really. I was just really reading the comments, okay? So if I had not studied it, I probably could have just got the answers from you guys. But I did. So I wanted to present to you in a way. Now listen, have you joined the boot camp? Because everybody in the boot camp is going to get these hot topics sent to them. All right, remember, REMAR review, we want to know that you guys are doing what you're supposed to be doing. So we're going to monitor you with our aftercare emails. You will get weekly emails from me, all right? And I will be making sure that you guys are focusing on the right things. I will be sending you reminders. I will be sending you how to use the program, All right, anything. All right, I really want you guys to stay in touch with me. All right, so with that being said, tomorrow, what are we doing tomorrow? I have questions and answers. I have a pile of questions that you guys have asked me about NCLEX that I will be going over. All right, so join me for that. Okay, join me for that. I may do an NCLEX review tomorrow too. Oh, you know what I got to do tomorrow? I have the email, but I'm also doing the quick facts review that I didn't finish. All right, so on Friday, we did not finish all of quick facts. So if you have the quick facts book, we're going to go over it. And I'm going to go over that pharmacology because people are like, oh, review pharmacology. So I'm going to be asking you pharmacology questions tomorrow. So if you think you know pharmacology, but you don't got quick facts, this is the review you need to be at. So tomorrow at 2 p.m., we're going to be back at it again. There's 252 people here tomorrow. So I need you all guys to show up tomorrow for me too, okay? All right, you guys, thank you so much for studying with me. One more time. What's up? Oh, that's right. All right, so the boot camp I talked to you guys about, you guys email me. Please continue to email me with your questions, but don't forget that this week is Cyber Week. All right, so listen, tomorrow, all right, tomorrow might be the last day for this Cyber Week sale, and I know a lot of people are taking advantage of the online academy because it is with that program. Remember, you get the money back guarantee, so you have nothing to lose. Plus, the online academy has the same lecture information as what is in the DVD package, but you just have the time quizzes. You have to get the 80% minimum. So it is challenging. That online academy is no joke. It is not a walk in the park. I know that there's some programs where you literally can just go through them, click, 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 and yeah, I know it. But with that online academy, it is not so. It is not so. You have to demonstrate, just like with NCLEX, you have to demonstrate that you actually know the information. And my questions are tough. They're not easy. Okay? So tomorrow I will be going over information that is in your DVD package. So if you haven't gotten the DVD package, still you have opportunity to get that. Whichever one is best for you, okay? We'll join the boot camp. Perfect. Got my quick facts book and DVD today. All right, Keisha, so you better come back tomorrow. All right, somebody said the link is not working for the boot camp. So you guys, it should be a link there and it should work. It should take you right to a sign up page. All right. I'm really excited about the boot camp. We've been working on it. All you have to do for the boot camp is click the link and we will take your information, your email address. Yes. All right. Okay. So it's super simple. How do we join? Yes. Tomorrow, pharmacology. So it's general pharmacology. There is nothing that you need to prepare for. Either you know it or you don't know it. Because even if I told you what it was, you're not going to have time to know it by tomorrow. All right. So just come prepared. All right. $150 off the online academy. Crazy. $150, $50 off the DVD package, you guys. So this is a time, if you were teetering, I don't know if you thought like, okay, I knew this information or I didn't know it today, but do what you need to do. Do what you need to do in order to pass the test, because I love you guys, but I don't want to keep reviewing the same people over and over again. I want a new batch of people and I want a new group of nurses. All right. I want a new group of nurses to review too. So, all right. So you guys, I'm going to get off here now. Thank you for studying with me. I will see you guys tomorrow, 2 o'clock Eastern time. Share with your friends. Let them know we're studying quick facts tomorrow. All right, if you have it. And also let them know we will be taking questions. Email me tonight your questions so I can go over them tomorrow. All right, you guys. I love you guys. See you later. Bye-bye.